Thank you very much, everyone. Thank you for the invitation. I'm Ruthy. I lead Microsoft's healthcare business across EMEA, Europe, Middle East, and Africa. And I want to talk to you today about how AI can be used in healthcare. But more than that, how AI is actually totally transforming healthcare today. So if there's one thing you need to remember from this keynote or take away from this keynote is what you're doing with AI in your organization today, not tomorrow, today. So imagine you're going to the doctor's office and there's no computer, right? The doctor is not sitting and typing everything that you're saying on the computer, but rather having a very nice conversation, looking in the eye. You get out of the doctor's office, the whole transcription of the whole visit is transcribed and entered into your medical file. You get on your app description of what was discussed, a recommendation for next tests, and already suggestions of when you can schedule the next appointments. Futuristic, right? So actually, this is what's happening now. It's not the future, it's the reality that we see today. I want to talk a little bit about, the trends we see in healthcare. I focus more on provider and payer, but of course our business spans also pharma, medtech, and life sciences. But the challenges are very similar. What we see is that, first of all, expectations are higher. We see a huge number and growing number of patients turning to the healthcare system, whether going to hospitals, whether seeking mental health help. So really, the expectations are becoming higher and higher. Burnout. We see burnout everywhere. We see it especially with providers. So doctors are overworked, nurses are overworked. So how can technology help us just reduce the burnout just a little bit? Data. I'll talk about data today. Remember, data is there's a lot of data out there, and it's produced every day. Huge amounts of data are produced. How do we tap into that data in order to really have data-driven healthcare? And finally, innovation. We see innovation everywhere happening in every industry, in every aspect of our lives. How do we bring that innovation into our day-to-day work in the hospital, in the clinic, at a health payer, at a pharma company, even at a startup? So back to the data topic. There's 50 petabytes of data produced in hospitals every year. 97% of it is unused. 97%. That means that literally almost every decision made in a health provider is not data-driven. So just imagine the power that this data can bring. Now, what's data? Data is multimodal today. We're used to data being, the tests that we took when we go to the doctors, or it could be how the medication is affecting us, or it could be how we feel, this kind of data. But there's much more data that we need to take into consideration. Our genomics data, our any social data that is where we live, do we work, do we have a family? All of these things influence our health. So how do we take that, what we call multimodal data, and take that into consideration when we diagnose, when we treat? So one thing important to remember is that AI is fueled by data. When we have data, that's when we can access it, we can extract insights from it, and decide on actions on top of it, right? So how really is AI transforming healthcare? And I think what's important to note is that Gen AI, so AI has been part of healthcare. So you've all probably seen, natural language processing models, various AI models. Really, the healthcare system has tried to adopt AI for many years, successfully, more or less, let's put it that way. Gen AI is a game changer. Why? Because you can access data no matter where it is. Because you can access data no matter what structure it's in. If it's free text, if it's an image, if it's just lying out there in some forgotten database, as long as we know how to reach that database, we can access that data. And the fact that we no longer really have to create that big data lake and structure all the data and align all the definitions, this allows us to access the data, extract insights and actions from it. Now, what else is different about Gen AI? That you can talk with the data in a natural language. I don't know how many have used ChatGPT or have talked with ChatGPT. All right, great. If you haven't, do it today. And I'll tell you why. Because you can talk to it like you talk to your friends or your family. You ask, so we got off the train. Where is the hotel? Apart from the fact that I can look it up in Google Maps, right? But I can ask, where's the hotel? What does it look like? I can ask anything I want. Like, how many people have had COVID in the past week? Maybe there's a new surge in the virus, right? So I can ask the data anything in a natural language. And that fact actually makes it accessible to anyone. It democratizes the fact that we can access data and extract insights from it. The other thing is that the progress is nonlinear. If you need, again, to remember anything, is that the progression and the development of AI is nonlinear. It's moving so fast that we need to constantly, so what you heard, like, me and my colleague here, we talk to health organizations every day. A conversation we had half a year ago is not relevant anymore because the technology is different. There is more insights, more capabilities constantly being developed. And the idea here is, how do we create a platform that allows any organization to extract as many capabilities from the technology out there, and always the latest technology that's out there, okay? So just to give you a few ideas, what can you do in your businesses with Gen AI or with AI? So first of all, think about your employee experiences, right? An employee experience, so for example, we at Microsoft, we have Copilot. When I need an internal document, and I used to go into the intranet and look for it, I ask Copilot. I have it within 2 seconds. Just think of, even if it's like, how many holiday days do I have? Vacation days I still have. These employee experiences, this is data that you have in your organization that all you need to do is give your employees access to it through, I heard people talk about agents, through these kind of agents. Customer engagements. Just imagine you go to a customer and you already have insights on what this customer needs without reading their annual report, okay, which is what we often do, without reading the annual report and understanding, wait a second, their growth should be here. Maybe, we should focus the conversation on 1, 2, 3, 4, 5. So these kind of insights. Or any process, right? Like your procurement process or your internal review process. Any such processes can be transformed like this with AI and Gen AI. I want to give you a few very practical examples of how we help healthcare organizations and mainly health providers, but also pharma companies and medtech companies to use AI in the day-to-day. So first of all, we said we want to go to the doctor and we want the doctor to be empowered, right? A doctor copilot. What is a doctor copilot? A doctor goes and sees a patient and does some kind of diagnosis. Usually the doctor does this diagnosis according to what they've learned in school and, the latest literature and so forth. But a Gen AI system can take all the literature immediately when they sit in front of the patient and look at all the possible diagnoses that could happen. For example, we did this in Liverpool in Australia, where cardiologists actually went to the literature, used Gen AI to ask for suggested tests that should be given to the patients in order to make the diagnosis more precise. Or a nurse procedure assistant. This is actually a project we did here in the University of Basel. So it's the clever colleague that actually guides the nurse through the procedure, reducing errors, making the procedure faster, kind of like a personal assistant that helps you go through procedures. If the procedures are very mundane, it helps not make errors. And if the procedures are unique or something we haven't done before, it guides you through them and makes you move faster. So it's a win-win. Discharge forms. I think this is one of the most prevalent use cases we see It takes from the minute a person is discharged from the hospital to the minute they leave, takes hours. Why? Because the doctors have to go and collect all the information from all the different departments. Now, it's done in minutes. Because, like I said, there is a model that goes and extracts the data, all the tests that that person did, puts it together in summary. The doctor reviews the summary. There's always a human in the loop. It's important to note that, and allows the person to be discharged within minutes. Conversational triage. This is a very powerful one. We did mental health is a huge topic. Like we said, a lot of people seeking mental health. There are not enough mental health practitioners. And basically, it's very hard to prioritize who needs immediate mental health help, who needs maybe help, maybe with a few, with some data or some information that we can share with them, and then we can see them in a month. And who is okay to what we call soft psychology. Can be, get some treatment or get some calming mechanisms like meditation and so forth. We developed, so one of our health organizations that we work with developed a mental health conversational intake model that talks in a natural language with a person, basically does the intake, so the initial interview that is done in the initial discussion between the therapist and the patient, and summarizes that for the clinician, for the healthcare practitioner to look at. First of all, the conversation itself has a healing effect because you know what? It's all in clinical trials. But you know what people said? Nobody has ever listened to me like this. The fact that the system knows how to ask questions and speak to you in a natural language is very, very powerful. And then it goes through diagnosis, and then you can prioritize. But this is what, it shows what natural language is all about. Finding patient information, like the employee can search for data within your organization. Why not let your patients, chat and search their rights? Okay, what can they look for? This is what we call chat with your data. It's probably one of the easiest use cases that we can apply tomorrow to any organization. And finally, operational. So, like predicting no-shows, right? No-shows, when a person doesn't show up for an appointment, costs a lot of money. So with a very straightforward model, you can predict no-shows. We have that with a hospital in the US, where they reduced no-shows by 30%, saved a few millions of dollars. Just by predicting, sometimes you can see that a certain person is more likely not to show up. So you can be actionable about it. So these are the kind of solutions. How many of you heard of Copilot? So it's kind of a new, cool thing that we have now at Microsoft. And it's actually really cool. We use it internally. And it's basically productivity based on Gen AI. All right? And it's based on what we all use every day, email, Excel, PowerPoint, and so forth. But the beauty of it is that it can really, really empower every single person that uses these systems daily. I want to show a short video just to show what it's about.
Start the show.
So I have to tell you, this changed my life. So I, for example, had to send my boss a report the other day about some kind of part of our business. And I needed to do like a histogram. I'm like, wow, I don't remember how to build that. Really, I mean, it's been too many years. I opened Copilot and it's like, extract insights from this data. I had like 5 suggestions for a graph that, were presented to me. And then it's like, wow, how did you build this graph? And it just took seconds, right? So I'm sharing these examples because the power of these tools, like we are all working endless hours, right? Some of these tools can really save a lot of the work that we do every day. Another example, one before, DAX Copilot. So we talked about the future of you go to the doctor and there's no laptop there. That is called ambient clinical documentation, where you enter the room, and this is the solution. It's called DAX Copilot, and it's based on Nuance solutions. So Microsoft bought Nuance a couple years ago. Nuance have many types of transcription services used in many types of industries, but the focus, our focus with Nuance is on healthcare. And basically, when Gen AI came out, we developed DAX Copilot, which is basically a tool that listens to the conversation that happens between the doctor and the patient, transcribes everything, summarizes it, extracts insights, puts it into the medical file, suggests next steps for the doctor, and done. This saves hours upon hours of typing. So this is a solution that is available in the US now, and we have a roadmap to bring it in different languages and different locations in Europe. A few other areas of development is, how do we analyze medical imaging better? How do we manage hallucinations? Right? I mean, let's talk about that. There are hallucinations, and we need to put guardrails and safeguards in place. So a lot of the work that we do is around safeguard and guardrails and safeguards. Looking at overall patient timeline, right? When you go to the doctor, usually you see, you talk about this visit, maybe 1 or 2 visits before. What about showing the whole view of the patient? Maybe when they're in the hospital, maybe they're in the GP, maybe they're holistic care, right? So showing that holistic care. So these are some examples of what we see, what we're working on. I was asked to talk about what's going to happen in 2030. So I have to tell you the truth. 2030 is too far away. Because what we see, right, probably in the next 6 months is changing and developing so fast that we need to constantly be aware of the technology that's happening. So if it's context, so today ChatGPT or OpenAI works on text, images, and videos. What if it uses now also EMRs, lab data, genomics data, right? So the context could be different, or social determinants, like we said. Modalities, right? What other modalities? Maybe we can also analyze the sound of my voice and understand if there is a sentiment in it. Or maybe, there's a solution that we're working with in the US that can actually predict Parkinson just by the vibration of the sound. So these kind of modalities and capabilities, that's what's entering our systems today. And I think one of the most important things to talk about is the new models that are constantly being developed. So just a couple months ago, there was ChatGPT 4.0. You probably heard about it. Now there is OpenAI 0.1. Just came out. And you know what it's about? This is the next platform shift. Because if up to now, OpenAI and ChatGPT looked at text and know how to extract information out of it, what we call parrot it, yes, like a parrot. Whatever text there was out there, like a literature review, it summarizes it much faster. Any documentation that's out there, it summarizes it much faster than I would do on my own. But OpenAI 0.1 reasons. It is trained on inference, and it knows how to suggest ideas. Maybe if you look at the results of a research, it can say, listen, these are the results of the research, and they can be applied to breast cancer, lung cancer, and colon cancer. Because it understands and reasons with the data and suggests next steps. And this is a game changer because this is what takes 250 years of science research and brings it down to 25 years. This is the next platform shift. And this is where the technology is not happening in 2030. It's now. It's reasoning now. And it's really looking at high skills, not only on the simple skills of summarization. It can be really an agent, like your co-pilot. That's why I always say it's your helper. It's like another researcher at your side giving you ideas about a diagnosis, about a research idea, maybe about other clinical trials that you should make, just by understanding, reasoning with the data. So this is something very important to understand because these are high skills that it is capable of looking at. So I want to leave you with really a thought. I really hope each and every one of you will go home and think, what will you do with AI today? Think of it as your co-pilot. Think of the use cases that can really make a difference and start today. Thank you very much.